assessment. Now, let me take you to the very crucial or the core part of this Prakruti assessment in this e-Prakruti app. So let me start that. I will click take new assessment. So basically, this e-Prakruti assessment are divided in three stages. One, assessment of these Vata Pitta Kapha parameters at build level or body level, at physiological level or at, that is activities level, and at mind level or psychology level. And purposely there are some mandatory questions which are marked with this red star button, which clearly indicates that if you don't select this option, you'll be not able to move to the next page. And I have inserted some of the images whichever like help you to choose. Say for example, in my case, my physique, there are these 5 options: very lean, moderate build, heavy build, and very heavy build. These images will help me to identify where exactly I belong. So in my case, I will take it as a moderate build and I will select out here. And there are some other options. These options are with the 2 variants, one with the circle, which are radio buttons, and other being with the square like this. So when you see square, it means that you can have multiple selecting options. Say for example, in this case, like my skin, it can be oily as well as it can be with moles. Okay. However, for this radio buttons, that is circle, I can be either very lean, moderate build, or very heavy build. I can't be both. So these questions with the options are designed in that way. Like the same, my weight. So I will select randomly this option. I do gain weight easily. Yeah, this, if I think it is not applicable, I will skip. So my skin, yeah, if it is not applicable, yeah, dry skin in all season. And of course, to select the complexion, this image will help you out. Say for example, in my case, let me go with the medium. Like the same, there are some skin variants like skin with dryness or oily skin. You can you can enlarge that image and understand where exactly you fall into. There are various options like the type of the hair, eyes, eyelashes, like prominent veins, whatever is applicable in your case. Please do mark and click on this button, save and continue. Yeah, it cautions me that choose question number 1 in section 2, that is short or tall height. I have not selected because as this was a mandatory question, I am forced to select this option as well as this option for this question. So what I will do, I will opt moderate height. And yeah, I think I have responded for all mandatory questions in this page. Now I will click on save and continue. Now it will take me to the next page where I will be having next set of questions. Say for example, my teeth, I will click on white. My nails, maybe like small, I will take. So like that, I can keep selecting whatever the options are applicable in my case. Yeah, again, 14 question being mandatory, so I don't miss that. I'll come down, whichever is applicable, I keep selecting that. Make sure that you try to answer as many as questions as possible, because more the question you attempt, better will be the outcome. Again, when I select the radio button, I will be having the option of selecting either of this. And if I select once, by default, I have to select either of this, right? Yeah, now let me move quickly. Again, I will be moving to 3rd page. Yeah, so here there are other options. I will select whatever is applicable in my case. Yeah, if I want, I can cancel both the options as they are square options. Yeah, so here I will take, all right. Yeah, Yeah, I think I will. Yeah, I will stop selecting my options because I think I'm done with most of the mandatory. In your case, try to attempt all the questions as much as possible, either with the single option or with multiple option. Multiple option, again, once again, I'm repeating, wherever you see square box, you have the option of selecting them in multiple manner, right? Now, I will click on save and generate assessment. Yeah. So I'm done with my assessment. Now I will go to the page wherein I can see my result either in PDF way or in web view. One more thing which I would like to suggest the users is that this application is best visualized on desktop. However, you can also operate on your mobile, but certain options you may not be able to see unless until you click on these 3 line buttons. In your app, it may be like this. So if you click on this, it will expand and accordingly you can select the options. So yeah, now I will take you how my reports look like. Yes. So it goes like this. First, it will give me the details about my BMI, fat percent, and the calorie, the energy, how much I need to consume to maintain my body weight. In my report, of course, I have selected some random options without attempting all the parameters. So it says that my physical body is dominated with pitta, my activities are influenced with kapha, whereas my mind is influenced with vata. These are the graphs which shows the same in a graphical way. You can click on them and see. There are some segments wherein the outcome of this Prakruti is given, like the outcome will be explained in terms of Vata influence on mind or Pitta and Kapha influence on mind, like the same with activities as well as on the build. You can read all these descriptions. And of course, there are some set of diseases as explained in Ayurvedic classics, which are called as Nanatmaja Vadis. If a person is having a dominancy of this particular dosha, then he's prone for some set of disorders. The same thing I have translated into English language and it is presented in this application. You can click on see more. These are all the diseases which I am prone for as per the options I have selected over here, and not necessarily I suffer from this, but tentatively these are the non-communicable diseases which my body is prone for. And to minimize these conditions, there are certain precautions which have been advised to be taken care. And there are some set of food articles recommendation. This is the column for the category of the food, like it can be milk and dairy, sweets, cereals, pulses, etc. These are the items pertaining to that category. So prefer means it is a patya as per Ayurveda. These items I can consume, whereas this column is the red background column is apatya, that is for limited use or prefer to avoid. Again, it is highly subjective. You can go through these items, and if it says that as apatya, then try to minimize their usage. And of course, we can't compile all the stuff as explained in Ayurveda over here, and hence I have given a food checker option for you. I will be taking to that to understand the best food items for my constitution. There are some qualities of these doshas, Vata, Pitta, Kapha, and accordingly I can select. Say for example, my overall Prakruti is dominated with, yeah, let me go up to understand, Pitta Vata. So here I have mentioned that Pitta qualities are hot, sharp, acidic, intense, and oily. If I take Belpuri, which do possess these qualities, means I'm not supposed to take much of Belpuri because it aggravates my Pitta. Thereby, I'll be prone for these Pitta conditions like stomatitis, or it can be burning sensation, blackouts, acid peptic disorders, so on and so forth. Right? So by following that, it will help you to maintain your health and avoid the diseases or the gravity of the disease condition. And there is other option called food checker, which you can access at the right part of the dashboard. Yeah, here also there is a food checker. So here, if you type first three letters of the food item, it's not the preparation, it's the food item. Here I will be not explaining about whether upma is suitable for me or not. Rather, it is the wheat. I can check whether it is suitable for me or not. So yeah, let me take wheat itself, WHE. Sorry. I need to type at least three letters and select from the drop down box. So here it says that for Vata, it is Patya. Vata Patya, yeah, wheat can be taken by Vata Prakriti person, Pitta Prakriti person, whereas Kapha Prakriti person, he need to limit the use of wheat, because here Kapha Patya is marked as for limited use. So say for example, if I don't know what exactly this wheat is, of course, I'm taking a very high level example. So in that case, I can click on this Wikipedia page and it will redirect me to Wikipedia site where I can see the image of this and also go through the various description pertaining to this wheat, including its nutritional values. That's about the, yeah, these are all the nutrition values pertaining to wheat. Like this, you can go through about 250 food items which I have compiled under this food checker. Yeah, that's about this e-Prakruti application. Say for example, after like a few days, if I want to recheck my Prakruti, or maybe because of some lifestyle changes or some dietary changes, I may come across some new changes in my body, and I will be curious to know what has happened with my body. In that case, I can click on retake Prakruti. That option will be there, but as I have selected gold plan, that is missing in this. If you select gold plus, you will be having the option of retake Prakruti. So you can click on that. In that option, you will be seeing the choices which you have made in the previous assessment, and accordingly, whichever is applicable, you can modify it. And when you submit it, you will be seeing the same kind of report, and it will also highlight where what have been changed in terms of percentage, so that accordingly, if you adhere to those recommendations, it will help you to manage your health in a better way. I think this application is going to be beneficial for you. Try to adhere to the do's and don'ts as explained in the chat. Of course, that's not the only option. There are various other options also you come across. Try to understand the expressions of this Vata Pitta Kapha doshas. And one more thing I would like to emphasize over here. Assess your Prakriti when you are in cool mind, when your mind is calm, when you are not in hurry, and when you are not suffering with the diseases, because basically Prakriti assessment is meant for healthy person. However, if you are diabetic or hypertensive or suffering with arthritis kind of thing, certain parameters may have the influence of those disease in selecting. Say for example, hunger. In diabetic patients, as you know, the appetite will be on higher side. I may get bias and get confused over here. My suggestion to you would be what you are feeling in the past 6 months or in the recent past, whether it may or may not be influenced with the disease. Try to prefer that option and make sure that that symptom may also have its impact on the disease. That need to be assessed in a very tricky way. Please be caution in that. Say for example, if you are having arthritis, because of that your movements have been slowed down. So in the questions like my activities, earlier before the onset of this arthritis, you may be quick mover. The option could have been quickly. Now because of disability, because of due to the pain in your knees, your action may be slow. Now understand what exactly has made you slow down in terms of your activities and wisely select that. In that case, I will suggest you to take before the onset of disease, how was your health? Select that option so that it will help you to understand your body constitution in a better way. Yeah, I think I tried to take you how best one can assess e-Prakruti. Assess your Prakruti and stay healthy. Thank you for watching this video.